One of the things I work with a lot is compulsive sexual behavior. And if you have compulsive sexual behavior or your partner does, you know it. Sometimes if you're dating someone with it, you start getting suspicious. You may have ideas that they have it, but you're not exactly sure. This includes any kind of hypersexuality or sexual addiction or anything like that. And although I don't see these people for treatment in a clinic, because I believe the best treatment is away at a sexual addiction clinic, I do work with the aftermath after they've been treated, after they're trying to restore some of the damage they've done. So I want to go through the signs and symptoms that you may have it or the person you love may have it. The first of these is the person has a recurrent and intense sexual fantasies, and they're ongoing. Their urges and behaviors, they take up all their time. And they get a sense that it's beyond their control. They feel driven to certain sexual behaviors, such as a release. If they don't do it, they can't get that release. And then after they do it, they feel guilt and shame. Or they use compulsive sexual behaviors as an escape. And this is what happens in the case of porn. It's a way for them to escape reality and feel better. They have trouble establishing and maintaining healthy and stable relationships. I see this a lot with my porn addicts. And you continue to engage in the sexual behaviors that have serious consequences, such as potentials for getting or giving someone else a sexually transmitted disease or ruining the relationship you have. They will go to any extreme at that point to have sex. These are the times you should see a doctor, okay? It's at before it's immediate, but it's still important that you go. If you ask yourself this, can I manage my sexual impulses? In other words, do you have control over them or do they have control over you? Am I distressed by my sexual behaviors? Are you distressed? Is your partner noticing things and they're distressed? Either one of those should prompt you to see a physician or a mental health care worker. Is my sexual behavior hurting my relationship, affecting my work, or resulting in negative consequences, such as getting arrested? Any and all of those are time to go. And do I try to hide my sexual behavior? I know a lot of people say they feel such shame afterwards that they slam their laptop down if someone they care about walks into the room. That means that you're not okay sharing this stuff, that you're embarrassed about it, and you definitely should see a mental health care as well as a physical doctor. So I think a lot of times why these continue, especially with porn addictions, is because people feel bad about it. So I want to remind you before you go that if you just go through this itinerary of why you should go, it will help. Number one, set aside any shame or embarrassment. Remember, this is about your wellness, and you have to put those two feelings aside in order to make yourself go, because it is going to be embarrassing and you might feel feelings of guilt and shame as you talk about it with someone else. Remember that you're not alone. So many people struggle with this, and they struggle in silence because they're not brave enough to go. And I'm encouraging you to be brave. Keep in mind that what you say to a doctor or a mental health care facilitator is confidential. For example, when someone tells me something in confidence in therapy, I am not allowed to tell anyone. Not only am I like that, anyone in my field, we take that oath of confidentiality. So these are the times you should seek treatment right away. If you think you may cause harm with uncontrolled sexual behaviors, if your urges are so strong as something you're going to do and you know it's bad, then you need it now. You have other problems with impulse control. For example, maybe your sexual behavior is also slipping out of control in your personal life, as well as you start noticing you're doing other compulsions like gambling, like overspending, like you'll go to any extreme. So, money is missing. You're going into financial ruin. Then I think the last one and most important one is if you feel suicidal, and this has a high correlation with suicide, any sexual addiction like this, then what I want you to do now is call the suicide hotline. And that number is 1-800-273-TALK. And that's 1-800-273-8255. You call that number immediately, or you can call 911. Go to the doctor, go to the ER, start there, and they will help you find help from there. Okay, so you're probably asking, what caused this? Like, I had great parents. I can't remember another time. These are the three most likely causes, although we're still not sure of possible causes. The first one, an imbalance in natural brain chemistries. Sometimes the chemistries, our brain is just a matter of a organ where chemicals are constantly washing over it. And if those chemicals are unbalanced, then your behavior is going to be prone to that. It's subject to that. And that's one of the theories of sexual addiction. Changes in brain pathways, sometimes dopamine, sometimes serotonins, and different hormones. The pathways to different receptors are off, and that's just something that you have to accept. There are treatments, but at the same time, I'm trying to just tell you some of the causes so you won't take it so personally. And lastly, conditions that affect the brain, sometimes brain trauma, sometimes PTSD trauma, things like that. Dementia can cause it. If you have early stages of Alzheimer's, that can cause it. Any part of damage to your brain, if you were in a car accident or whatever, can have tendencies to cause this. So what are the risk factors? When we look for people that are addicts, sexual addicts, or heightened sexuality, we look for certain conditions, like what are risk factors? What makes this person's environment more of a risk? Well, they have ease of access to sexual content. That's everybody now. If you have a phone, you have ease to content. And privacy. If you have privacy, if your life is set up in a very private mode, then this is a much tougher addiction to get over. And not only that, but it is a high risk factor. So the first thing that a part of the treatment would be changing those two situations. And then the other risks for compulsive behaviors like a sexual addiction would be an alcohol or drug problem, another mental health problem such as depression or anxiety, family conflict, family drama, family abuse, any kind of abandonment issues, or a history of physical or sexual abuse. But not everyone with a sexual addiction or hypersexuality has been perpetrated or sexually or physically abused in their past. So the complications from this terrible disorder, if you don't do something about it, is you struggle with feelings of guilt and shame, and they're almost unbearable at times. You develop other mental health conditions. You may start getting depressed, suicidal, incredible anxiety, a neglect, or you lie to your partner or family. Lies are a big part of this, and that's why the denial is so strong and keeps people locked into it. They lose your focus, or you engage in sexual activities or search internet pornography at work, so you know what's going to happen with work. And that's next. You basically have trouble at work and you accumulate financial debt because you'll go anywhere to get satisfied. When those urges come and there's nothing in control of you, you will go anywhere and spend anything you have. You could contract sexual problems like HIV, like STDs, anything like that, because once again, your impulse control is not there. And so you take risks you normally wouldn't take. You engage in unhealthy substance abuse. Sometimes people use alcohol and drugs as medication to control their urges. And you're going to eventually get arrested for sexual problems. And if your partner doesn't know, finding out that way is terrible. So how do we prevent this from ever happening? Well, If it's happening, you've gone beyond prevention. You're going to need treatment. But before that, if you're with somebody who you know uses porn a lot, or if you use porn a lot, you can get help early. You can go in, if you start going, you know what, I've realized I need this as my escape. This is my main escape. During the pandemic, we've seen an increase in porn use. That's because people are needing relief from anxiety and they need an escape. Seek treatment with mental disorders. Many times other mental health disorders are behind a sexual addiction or a hypersexuality. If you get treated for depression or anxiety, many times those will quiet these urges. Identify and seek help for drug and alcohol problems. If you know that these impulses are stronger, or that you are using drugs or alcohol to medicate them, then it's important you get treatment for that medication and get to the bottom of what's underneath it. Why are you using it? That is a huge step for people, especially when the drug they're using, the medication of choice, whether it's illegal drugs or alcohol, is part of the problem and wrapped up to it. And lastly, avoid the risky situations. Have a roommate. Be accountable. Make a pact with your partner. Okay, I'm not going to take if I have that urge, help me take my internet away. And that's why I encourage you, if you're with someone who is trying to go through this, it's a really good idea that they go to an alcohol drug facility treatment and that you go to Al-Anon, because more than likely, without even knowing it, if you love this person, you're enabling it, and you don't ever want to do that. So please, if you are feeling like you have this problem, and it is a terrible problem because it ruins all areas of your life, and it really, any love you have, it will destroy it if you don't take control of it. If you have this, please seek help today.